use normal for common. Some of the human estrogens in female, we have 3. And you remember them by going estrone. Estrone has a 1 in it. Estradiol has a di, 2. And has a tri, 3 in it. And this is what the makeup is. You roughly have E1, E2, E3 in a female's body. And guys, we just have a couple different kinds of estrogen. And however, look at the ratios, 10 to 20, 10 to 20. And I bring this up because when you're giving hormone therapy, when you give a drug therapy, they don't care which one it is. They give just this thing called estradiol. And they don't even care about the other ones. Well, estriol is anti-cancer. It's the one they use in Europe. It's actually protective. So when you just give straight estradiol, first of all, you're doing something that's not natural to the body, and you're not giving it in ratios, and you're not testing. Look at some of the estrogen functions. By the way, these are the same, or fairly close to the same, as testosterone functions. Water content and elasticity of skin. Same with human growth hormone. If you're not sure, go like this. This is a rough test. Let's do this just once. Everybody kind of go like this. Just bounce it. How much does it bounce? How fast? If you can see it going down, okay, that usually means that the people that are hiding their hands are usually the ones that didn't see it. If you can see it going down, that usually means a couple of things. Maybe you're just dehydrated, or you don't have enough human growth hormone, or you don't have enough elasticity in your skin. Sexual and libido function. Estrogen is an antioxidant. Wow. It maintains bone and dental. Lowers blood sugar. So estrogen is actually used for blood sugar. I've got several patients on testosterone, guy patients, because testosterone actually is used for diabetic patients to get them off their diabetic medications. And over a course of 6 to 9 months, you can reverse 90% of diabetics. We're using testosterone. And in females, using estrogen. Decreases heart disease up to 50%. Helps lower down blood pressure. Helps immune function. Lowers down inflammation. Estrogen is anti-inflammatory. Formation of neurotransmitters. You need estrogen to make serotonin so you feel good. Vision, memory, mobility, growth and repair. Growth and repair is big, growth and repair. And that's estrogen, and when I say estrogen, I mean what your body produces. And for guys, it would be testosterone, same kind of thing. It's unfortunate because a lot of the things that happen for a guy, it's really casual. We start gaining a little weight, right? We start lowering our energy a little bit. We start not moving as fast. We don't say a lot of things about that, right? Because it's amazing how that works. But however, if we got hot flashes every day, trust me, we'd be into a doctor. Okay? And hot flashes and night sweats. So it takes sometimes, the guy has to come in usually through the wife or something, because that's usually what's happened is that guys, it's more subtle. They don't notice it. Where women usually get that crash where they get the hot flashes, they know right away.
Why do men need estrogen?
You know what, you have a small amount of estrogen that's needed for your brain to signal that testosterone is okay. And so a small amount, if you had no estrogen, your body would not actually register the testosterone in the brain. And then your body would actually not use it. So, but if you have too much estrogen, the body thinks you've got enough testosterone. So in the male brain, the body uses estrogen to regulate the amount of testosterone it sees. So non-human estrogen. Here's a crash course. Look at this. Estrogen, they use the word estrogen. This is Premarin. This not estrogen, but look, even the Time magazine, doesn't it love this? It's called the power of association and simulation. It's great for marketing. It makes you think that's the same, isn't it? But that's not the same. That's not estrogen. That's a drug made to look like estrogen. I'm prescribing monkey hormones. They won't stop your menopause, but climbing trees will take your mind off the symptoms. Okay, so Premarin, pregnant mare's urine, is not bioidentical. I went on my trip last year. I went to this place called Columbus Isle, and I met the actual pharmacist that actually invented Premarin. He was in Montreal. Yes, yes. And I said, didn't you? And he said, oh, that's natural. It comes from a horse. I couldn't convince him it wasn't natural. Yeah, it's just terrible because the horses are all lined up. It's not like they're roaming free and you just collect it. They're actually there. So it's not even sad for what you give us with it, but it's also sad for the horses. So Premarin, 40 more estrogens. A lot of them we don't even know because you can't regulate the urine of a horse. Estrone is 75%. Look at the ratios here. Equine, which is 6 to 15%, and by the way, that's horse estrogen, which is 1,000 times more likely to cause a breast cancer to misdivide. It's estradiol and others, and does not contain the protective estriol. So it doesn't have the right amount. It contains estrogens that the body doesn't even use. It has ones that are more prolific and does not have the protective one. And that's the drug they were using, and that's the drug they call hormone replacement therapy for the longest period of time, and that's the drug that was studied, and that's the drug that was removed. And so when a doctor says, take you off hormones, because hormones are bad, no, these ones are not hormones. That's a drug.
Have they banned it yet?
No, they didn't ban it. They still use it. They still use it because what happened is I remember when there was a big study that came out several years ago, July 2002, which basically studied Premarin and something called Provera, which is, I don't want to get into that right now, but it's progestin. It's something that made it look like progesterone. And something that's made to look like progesterone. And I remember that study coming out and all the women that were lined up at my door because all the doctors took them off the drug. All the doctors took them off drug. Now what's happening is you've got so many women coming in saying, I don't want to be on the antidepressant that you got. I don't want to be on the beta blocker that you got to control. I want to go back on it. So some people are getting birth control pills now for hot flashes and also getting Premarin a little bit. Okay, I'm not going to worry about that. Balanced bioidentical hormone placement. What you're trying to do in general is give a person the levels that they had when they were the healthiest adult. So actually from 25 to 35.